Hello everyone, I'm a doctor. Today I'm going to talk about osteoarthritis and our treatment of choice, which is regenerative medicine. Osteoarthritis is a very common problem, especially as we get older. It can also be caused by sport injury or overuse injury. And when we talk about osteoarthritis, we're talking about a gradual wearing away of the cartilage. What we have in our joints, our knees, our hips, our shoulders, our elbows, our wrists, our spinal cord, the discs in our lower back, they all have cartilage. And as we get older or with injury, that cartilage can wear away. And when it wears away, we get down to the bone. And then what happens is we get bone on bone, rubbing on bone, and that causes a lot of pain and a lot of inflammation. And as that process goes on, it gets worse and worse and worse. And eventually there's no cartilage left, and we have bone spurs, and we have bone on bone. And if you've ever heard of a total knee replacement or a hip replacement, that's what they're doing in those surgeries, replacing that worn-out cartilage with either metal or with plastic. So our treatment of choice for osteoarthritis is called regenerative medicine. And that is taking stem cells from your own body, your own fat. And we extract those stem cells through a procedure called microlipo. It's very easy. It takes about 20 minutes. We do it in the office. The patient's awake. It's not painful, but we use local anesthesia so you don't feel anything. And we take just a little bit of fat from your own body, your own fat, and we put it into a centrifuge and we spin it down. And at the bottom of the centrifuge, what we end up with is the stem cells. And these are the most powerful, potent stem cells in your body. They're called mesenchymal stem cells. They have the ability to turn into any tissue in your body, including cartilage. So once we extract those stem cells, we then inject them back into your body, into the area of the joint that's affected by osteoarthritis. And those stem cells go to the site of injury. They go to the area of the joint that's inflamed and damaged and worn out. And they begin to grow, and they begin to repair, and they begin to replace that damaged cartilage. The entire process is actually very quick. It takes about 2 to 3 weeks for those stem cells to grow and multiply and start repairing the damage. And then what we see in our clinic is that the inflammation goes down, the pain goes down, and the range of motion and the function of the joint gets better and better and better. So if you suffer from osteoarthritis, if you're suffering from any type of joint pain or inflammation, I would recommend that you contact our office. You can reach us at amhealth.ca@gmail.com, and we will be happy to answer any questions that you might have and to schedule you for an appointment. Thank you very much.